Hello and good afternoon from the Brazos County Health District. Thank you for joining us this afternoon. We have a lot to get through today, and a special guest here today, Judge Steve Smith of the 361st District Court, here to discuss juries, upcoming trials today as well. And Mayor Mooney, Mayor Nelson, and Mr. Chad Wooten with us as well for question and answers at the end. Quite a bit of information to get through. Again, a situational overview, get you the numbers most recently here. Some information about the COVID-19 response system, as well as some delays in reporting, mobile testing collection site, upcoming 4th of July celebrations, some questions about isolation rules that have come in, and also some questions about the difference between COVID and the flu that we will hit on before our question and answer period, actually before Judge Smith comes up and gives some words, and then into our question and answers. As of today, June 29th, there have been 121 additional positive cases of COVID-19 reported to the Brazos County Health District. This total number of positives brings us to 1,943. Total number of recovered estimated at 821, leaving 1,093 active cases. Numbers currently hospitalized: Brazos County numbers 34, Brazos Valley 50. The daily discharge Brazos County residents 3 over the past 24 hours. Our occupancy as of this morning, 64% hospital beds for Brazos Valley, ICU beds 63%. Again, this is that number that changes, is very fluid, literally by the hour, but we get that in twice daily basis right now, and we'll start reporting that on a daily basis moving forward due to your request. Total number of deaths at 29, 4 additional deaths reported over the past week. A female in her 70s who was hospitalized, another female who was in her 80s and also hospitalized, a gentleman in his 60s, and one other female in her 60s passed in the past week. Total number of tests to date, 19,651. So since our last press conference a week ago, there's been an additional 683 cases that have been reported and vetted through the process. 36% of the 683 cases are in the 18 to 24-year-old age group. The community spread, which we've talked about before, is when we have a case and we cannot identify that case with someone else who is on our list, so to speak. We call that community spread, and we are still seeing plenty of that. As a matter of fact, 72% of the 683 cases reported in the past week are considered community spread. As far as the COVID-19 response system, the local COVID-19 response system continues to be strained due to the increased number of cases. Local healthcare providers may have longer wait times for testing, which in turn delays reporting of positive cases to the health district. Once a positive case is reported, staff calls the patient to get more information about symptoms, about close contacts, and all this information that is going to be shared by the client to the health district is confidential. This is all confidential information, including the information about the close contacts. Contacts will not be notified of the person they were exposed to. If the health district staff does not reach the person, the case, who we're calling, they will leave a message asking them to call the health district. The number may come up as an unknown number. It may come up as a 979-775-7400 number. We are seeing a lot of folks who are not answering or not calling us back. So please do so. We estimate that number to be around 20% of cases not calling us back. Very important that we do that. We get this information so that we can, we talked about the box-in process in previous press conferences. That only works if we get this information and we can find your potential contacts. Again, it's important that we do that, 7 days a week this is going on. Literally all hands on deck here at the health district. Right behind these walls, as right now, these phone calls are being made and working on processing these cases. Again, we've also had a wonderful help and collaboration from the university, Texas A&M School of Public Health in particular, helping out with this process also. Literally this week, and so that is going to help moving forward as we expect more cases. As far as delay in reporting, due to the reporting system being strained locally and across the state, there have been some cases that have come through a database that were not readily available to us that have since been identified. And now we're aware of those cases. We estimate there's about 80 or so in that system. And so those are all being vetted as well and will be reported as they are vetted. A mobile testing collection site. This free drive-through testing we've talked about in the past. There was concern about the turnaround time, a quite long turnaround time. We're hearing that's better than it was in the past. We hope so. But that'll be July 7th and July 8th. That'll be set up Brazos County Expo Center. Again, appointments are highly encouraged to streamline the process, and all that information is available on the website. But the appointments are available 8 to 5 on each day. Again, July 7th and July 8th. You do not have to be a resident of Brazos County to be tested. 4th of July celebrations coming up. Health District encourages you to practice social distancing and to wear a mask during the 4th of July fireworks and celebration. If you are at an outdoor event, if there's porta potties there, I mean that is a high risk situation for transmitting this virus. We have to remember that. So try to avoid that at all costs. Use the restroom before you go, and afterwards, if you can, stay in the car and socially distance. That's the concept here. Some question about isolation rules. There gets to be a lot of confusion about why 10 days, why 14 days. And it comes down to the difference between what is a quarantine, what is an isolation. Isolation, remember, is I think I have the virus or I do have the virus for sure, then I'm going to isolate myself from the rest of the community. That isolation needs to be from the time I develop symptoms for 10 days, for a full 10 days after that time frame. The quarantine is a little different. The quarantine is I was exposed to somebody today, and I am told, we're going to say today is the date that I was exposed. For 14 days, I am going to avoid contact with others. That is a quarantine. I don't think I have it. I don't know if I have it, but I'm going to be in a quarantine. Now, of course, if I develop symptoms during that 14 days, I am going to alert the healthcare system so that I can be tested and confirmed. Again, that gets me into that box it in concept of identifying where the cases are for sure and the contacts. And so that's the difference. That's where that 10 days comes from and the 14 days, isolation and quarantine. And some questions also about COVID and flu. Very different viruses. Transmitted similarly, but remember, COVID-19, nobody has seen that. We are think about it as a naive population to this virus. Lots of us have had flu before or had our flu vaccination, and so influenza does not have the ability to transmit through the population like COVID-19 has been able to do. We're also realizing that COVID-19 is more fatal than flu and is causing more hospitalizations than your usual flu year. There can be some bad flu years, make no mistake, especially 2009 when we had a reassortment of the virus. It was a new virus that was introduced to the population where we had similar numbers in hospitalizations. But again, some big differences between the two. So this is not the flu. So sorry to go through that.